Hi, my name is Kendra, and I will be going over my research article outline. It was changes in the anxiety levels of patients undergoing percutaneous coronary intervention. The whole main reason of this research article was to discover how anxiety affects each individual's differently by looking at them pre-surgery, post-surgery, and 6 months to a year after. It is to examine the differences in anxiety levels based on the patient's backgrounds. The summary of the article, it showed that 32 to 77% of patients in this research study was shown to have anxiety found in patients who had coronary heart disease. Anxiety was seen to have increased 1 day before and 1 day after treatment of CHD, and then decreased by 6 months to a year later. It also did show that some were still having high rates of anxiety even 6 months after the procedure was done. Women were reported to have higher anxiety levels than the men were who went under percutaneous coronary intervention, but in this research study they mainly focused on the male subjects. During it, there was high levels of anxiety noted. It was important to conduct this research study just because there wasn't a lot of research done on how anxiety can affect people that do go and have elective surgeries done. So this opens up our world to understand that anxiety can affect anybody and everybody differently. They used the quantitative experimental design in this research article. There was 165 male subjects. They did start out with 208, and a lot of them either didn't return the phone call, passed away, or just refused to complete the study, so they only ended up with 165 participants at the end. They were of Arabic, and they came from Jordan, from 2 different hospitals this study was conducted in. Each and every participant was diagnosed with congestive heart disease at one point, and this was their first elective PCI intervention. Their ages ranged from less than 50 to greater than 50, with majority ages of 50 to 60 years old seen in this. They also did have research done about the clinical characteristics that was seen doing this study, and it ranged from smoking, alcohol use, marital status, any recent hospitalizations, and that did play a major role in how their research study was conducted. The data that was used to obtain all these measurements was the Generalized Anxiety Disorder Scale, and that was their analysis of it, which it did give some valuable feedback and was able to score these individuals on how bad their anxiety was. Like I said, they did use male individuals for this, and this was their first elective surgery undergoing the percutaneous coronary intervention. Step-by-step description. They conducted over initial assessment before the PCI was done, after the PCI, and 6 months after the intervention. Recruitment includes first time, 18 years or older, free of pain and stable, and able to provide consent for participants, and who was able to read, write, and communicate in Arabic. It was conducted in 2 hospitals, one in Amman and one in Irbid. The experimental group was randomly selected. You just had to have some of those qualifying features to get into this study, but it really wasn't how they specifically went and picked someone. There was no experimental activities associated with this study. It was mainly just what was previously stated, the first-time elective percutaneous coronary intervention, 18 years or older, free of pain, hemodynamically stable, and all that. What they used to collect the data was the data analysis conducted using the statistical packets for social sciences, which is kind of commonly seen whenever they are doing these types of research studies. The findings showed that the anxiety scale was used and shows that most of the patients in the study had mild to severe anxiety at baseline, which is about 82%, and after 6 months at 72% had reported a change back to baseline. But some were also stated that they did still have rising or the normal anxiety that was seen at the time of surgery. Research conclusion. The level of anxiety determined at 1 day post-op. There was a need for further intervention to assess the psychological needs of these patients. And that could have been obtained by more thorough education to better understand what they were going in, what to be prepared for. And then at the 6-month post-op mark, there was a significant decrease in anxiety levels in majority of these. But patients who were seen as smokers, younger individuals, and those who lacked education seemed to still have the higher levels of anxiety. My personal thoughts of this: prior nursing education and stress reduction techniques before PCI could have been more reiterated before and after the procedure to help decrease the levels of anxiety, especially in those who were seen to have higher anxiety and who hit the clinical characteristics of the ones who did seem to have higher. The research could have been conducted in a little better of environment. Instead of phone calls, they could have had these people come in and seen them face to face, due to how they were not answering the phone and not responding back to answer the questionnaire that was done. This could have been avoided by doing, like I said, the follow-up evaluation in the hospital setting, where the nurses and doctors could get an eye on these people to determine what would have been a better fit for them to reduce their anxiety levels, such as cognitive behavioral therapy, anything that could have helped reduce their anxiety levels. This research could be duplicated to have a better understanding of what anxiety can have on the human body before and after this procedure is being done. There was a lot of weakness I noticed in this study, just due to the fact of how much was lost during this. Also, it could have been done better if things were done in a different fashion, such as coming in a couple days before procedure and laying eyes on that patient before procedure instead of just seeing them the day of, because everybody's going to have anxiety before a procedure no matter what. So it would have just been a little bit better, have them come in a couple days, see how they are, and then have them come in the day of, and also compare and contrast what was seen the couple days before till now. And that way we could re-educate and ensure that they are in good hands. The 1 day post-op shouldn't have seen a big high level of anxiety in these ones since the procedure was already done, but I can see that education was needed as well, just to show them what to expect over the next couple of months after going under this procedure. And then at the 6-month checkup, It could have been done a little closer, but it worked out in their favor. And that is my outline. Thank you.